Gauteng Department of Health will tomorrow be commemorating the Mental Health Awareness Month at Kagisanong on the West Rand. The theme for the event is mental health and older adults. The focus for this month is on the elderly population and their families who are expected to look after them. For more on the story, we now joined in studio by Dr Johanna Manamela from the Gauteng Department of Health. Doctor, good morning to you.
Good morning, sir.
Now, the focus is on the mental health of the elderly for this awareness month.
Yes.
And what are you trying to achieve with this?
Okay, we want to achieve the promotion of mental health in elderly people. We have realized that most of the time elderly people are ignored. Even if they are mentally ill, they tend to be not seeking treatment because nobody is taking care of them. So the focus is to encourage the community to recognize their dignity as mentally ill, also to popularize the challenges that are faced by the elderly people. You will realize that when you grow older, even your body physically and otherwise become older. But that does not mean that everybody who is old will be suffering mental illness. But we have noticed that those who are suffering mental illness during the elderly stages, they tend to be ignored. And we look at the causes and factors where we find that most of them are undergoing treatment. Most of them have got funds that now available. They don't know what to use. Sometimes they use it to buy liquor, and we find that that also contributes to mental status. Some of them are lonely because wives, children, or husband and family members, most of them passed on, and children moved from home to their own apartment, and we find that they are lonely. As a result, they become depressed, they need someone to talk to, they are even inactive. So we are trying to say, during this activity, we want to popularize the focus on elderly people so that they are taken care of, also to ensure that we indicate what type of resources are there in the community for people to use and improve the mental health status of the elderly.
Let's just take one step back, Doctor. What is mental health? Mental illness, rather.
Mental illness, in short, I can say is when a person's mental status is now having some challenges, like maybe a person cannot be facing reality, like a person who is not mentally ill, who will understand the reality, will understand the time of the day, the touch, and so on. But mental illness, people find that they can't understand what is going on around them, and that's the biggest challenge. And we can say, actually, everyone can be mentally ill, and everyone somewhere, somehow suffers a little bit of mental illness, but it's just that it's not reaching the status where a person cannot understand what is going on in his or her surroundings.
Now, the focus is on the elderly for this month, but what about younger people?
You know, for mental health of all our people, it starts even before birth, because we need to start there. By the time you reach elder stage, you are already knowing the facts about mental health. So we are not leaving them behind, but we know there are months that we focus on them. But for this one, we are focusing on improving the health of the elderly and how we can really maintain their dignity and ensure that they are living effective life.
Are you working with community groups in communities to assist and help and spread the awareness out there?
Yes, we work with the community group. We've got 5 districts in Gauteng. In each and every district, we've got mental health sector, and most of the time we are working with the NGOs, we are working with the youth at school, youth outside school. We also work with them, and we work with the population at all, even those who are not sick. We also engage them, and those who are sick also have got systems that will ensure that we lessen the disability that they experience.
Now, how do you ensure as a department that mentally disturbed people are being taken care of?
Okay, well, we have got programs, and we have got a program at preventative level. Like what we are doing now, for tomorrow it will be a preventative level where we educate people on what signs they should look at, and also what should they do when they are having challenges in mental illness. That's number one. The other thing is that we also have hospital. All our hospitals, they are taking care of mentally ill people. Anybody who's experiencing signs of mental illness at home, the nearest hospital in Gauteng will be able to assist them. From that level, we go to another level where we've got specialized mental health services. From those hospitals where they've been treated and they are not improving, for example, in a district hospital, and then to regional hospital, they are now taken to psychiatric hospital, and that's where we manage them there. And we also have programs that are assisting people. Some of the people find that it's just something that triggered them, and after we put on the resources and treatment modality, they are back to normal and they are discharged.
Where can people get more information, just briefly, Doctor?
Okay, people can get more information from our province. I will say the number that they can use now is 011-298-2467. And also in our hospitals, they still can get some information. And also in all the district offices where we find there is a district for general health, there is a wing there for mental health services.
Thank you so much. That is Dr. Johanna Manamela, the Gauteng Department of Health.